Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Have you ever noticed how certain remedies seem to they keep popping up. You hear about them everywhere, across cultures, generations even.
Absolutely. And ginger is definitely one of those, a real superstar, you could say.
Yeah, exactly. Maybe, you tried a ginger shot or perhaps added it to tea when you're feeling a bit off.
Mm-hmm. Very common uses.
But what does the actual science say about this root? Is it all just hype or is there substance there?
That's the big question, isn't it?
Okay, let's unpack this then. Today, we're really diving deep into the world of ginger. We want to look at the science-backed benefits, figure out what makes it tick, those active compounds, and what the very latest research is telling us.
And we've certainly got the material for it.
Yeah.
We've looked at quite a range of sources for this deep dive.
Oh, yeah. Like what?
Well, everything from, general health news articles that sort of touch on its popularity to a really comprehensive umbrella review. And that's quite significant because it pulls together findings from dozens of other reviews and individual studies. It's like a review of reviews.
Wow. Okay. So that gives us a pretty high-level view, right? High confidence.
Exactly. A very good starting point for assessing the evidence.
Sure.
And we also looked into specific reviews focusing on its potential for, say, arthritis and even neurodegenerative conditions.
Right. So our mission today is really to cut through the noise, maybe some of the anecdotes, and give you, our listeners, a clear evidence-based picture. What can ginger actually do?
That's the goal.
So first things first, what is it in ginger that gives it these, amazing properties? What are the key players inside that root?
Well, what's really fascinating is that ginger's power isn't from just one thing. It's a complex mix of bioactive compounds, natural chemicals that have effects in the body.
Okay, a mix.
Yeah, the major ones people talk about are gingerols, especially one called 6-gingerol, which you find a lot of in fresh ginger.
Fresh ginger, right.
And then there are show gels, particularly 6-show gel. These actually form more when ginger is dried or heated.
So processing changes things.
It does. The compounds transform. And these, along with others like paridols and zingerone, are really the core reason why ginger is known for its anti-inflammatory and antioxidant effects.
So how do they work? I mean, what are they doing at a cellular level, roughly?
It's quite complex, but they basically modulate different pathways. Things like signaling molecules that tell cells whether to survive or undergo programmed death. They can also affect neurotransmitter systems in the brain.
In the brain. Interesting.
Yes, and they work to decrease inflammatory factors circulating in the body. Think of them as regulators, kind of fine-tuning different processes.
So whether you're chopping up fresh ginger for a stir fry or using dried powder in a supplement, you're getting these beneficial compounds, just maybe in slightly different forms or ratios.
Exactly, different forms, but you're still getting beneficial combinations. Both fresh and dried are potent.
Okay, that makes sense. Now let's talk about that umbrella review you mentioned. That sounds like a cornerstone piece of evidence.
It really is a huge amount of data condensed.
So what does it tell us for people listening? What are the health benefits where the evidence for ginger is like really strong, rock solid?
Right. If we look at the big picture from that review, the most robust evidence where we have high confidence for taking ginger orally is in a few key areas.
Okay, let's hear them.
First, and this is a big one, for pregnant women experiencing nausea, ginger shows a very large antiemetic effect.
Antiemetic meaning anti-nausea.
Precisely. It significantly reduces how often nausea occurs and how severe it is. Some studies shows women taking ginger were actually 7.5 times less likely to experience nausea compared to those taking a placebo.
7.5 times. Wow, that's not a small effect. I know so many people who swear by ginger for morning sickness.
It's a substantial difference, yes. And the evidence backs up that anecdotal experience quite strongly. The theory often involves ginger's compounds interacting with serotonin receptors, which play a role in nausea signaling.
Fascinating. Okay, what's number 2?
Second, for people dealing with osteoarthritis, the review found ginger statistically significantly reduces both the severity of pain and the disability related to that pain.
Okay, pain and disability. How big is the effect there?
The effect size itself is considered small to moderate, technically, but, and this is important, it's considered clinically significant.
Clinically significant. What does that mean in practice?
It means that even if the measured effect isn't huge on paper, it makes a noticeable difference to the patient. And in this case, the relief is comparable to what you might get from non-steroidal anti-inflammatory drugs, NSAIDs.
Like ibuprofen.
Exactly. So achieving similar relief to common painkillers is definitely meaningful, especially from a natural source. It might offer an alternative or a complementary approach for some people.
Right, especially for those who maybe can't tolerate NSAIDs well. Okay, what else stands out?
Third, there's moderate confidence in ginger's benefits for glycemic control. This is particularly relevant for individuals with type 2 diabetes.
Okay, blood sugar management.
Yes. It can significantly reduce insulin resistance, lower fasting blood glucose levels, and also improve glycated hemoglobin, or HbA1c, which is a marker of long-term blood sugar control.
And improvements there are important, right?
Very. Even a 1% decrease in HbA1c is considered clinically meaningful. It can significantly improve long-term outcomes and reduce the risk of diabetes complications.
Okay, so those are the top 3 with strong or moderate confidence: nausea in pregnancy, osteoarthritis pain, and blood sugar control in type 2 diabetes. What about other areas? You mentioned other reviews. Does anything else show promise, even if the evidence isn't quite as locked down yet?
Oh, definitely. There are several other areas where ginger shows moderate to large beneficial effects, but maybe the overall confidence in the evidence is rated a bit lower, perhaps low to moderate.
Like what? I'm curious now.
Well, things like helping to reduce blood pressure, both systolic and diastolic readings.
Oh, interesting.
Also assisting with weight management. Some studies suggest it can help reduce body weight, BMI, hip circumference, and that waist-to-hip ratio, possibly through effects on metabolism.
Okay. Anything else?
Yes. Also alleviating dysmenorrhea, that's painful menstruation.
Right.
And reducing nausea after surgery, postoperative nausea. It even shows some benefit for chemotherapy-induced vomiting, which can be incredibly debilitating.
Wow, quite a range.
It is. And there are also some noted improvements in general markers of inflammation, like C-reactive protein, or CRP.
I've heard of that one.
Yeah, it's a common blood test marker for inflammation. And also improvements in the body's overall antioxidant capacity. But as I said, the certainty for these specific markers is currently considered a bit lower based on the available evidence. More research needed there.
Okay, this next area you mentioned, neurodegenerative diseases. That sounds incredibly interesting, the idea that ginger could impact brain health.
It really is a compelling area of research. It raises a fundamental question. How can a spice, a simple root, potentially affect something as complex as brain health?
Exactly. What's the thinking there?
Well, the research suggests that common threads in many neurodegenerative diseases, thinking, Alzheimer's, Parkinson's, multiple sclerosis, involve chronic inflammation and oxidative stress in the brain.
Okay, inflammation and stress at the cellular level.
Precisely. And given what we know about ginger's strong anti-inflammatory and antioxidant properties, those are the key mechanisms being investigated here. Ginger's compounds might help counteract those damaging processes.
So what does the research actually show? Let's start with, say, Alzheimer's.
Okay. For Alzheimer's disease, most of the work so far is preclinical, meaning in lab settings or animal models. These studies have shown that ginger compounds can potentially reduce the buildup of certain proteins, like amyloid plaques, which are associated with the disease.
Right.
They've also shown improvements in memory in these models, and even increases in nerve growth factors, which help support brain cells.
What about in humans?
Human studies are much scarcer, unfortunately. Often ginger is included as just one part of a multi-herb supplement, making it hard to isolate its effect. However, there was one notable placebo-controlled study using a standardized ginger extract.
Okay.
It involved middle-aged, healthy women, and it found that ginger intake, especially at a dose of 800 milligrams per day, actually improved cognitive processing capabilities compared to the placebo group.
Improved thinking in healthy women. That's intriguing.
It is. It hints at a potential cognitive enhancement effect, though more research is definitely needed.
What about Parkinson's or MS?
In Parkinson's models, again, mostly animal studies, ginger has shown neuroprotective effects. It seems to inhibit the overactivation of certain brain support cells called astrocytes. When these become overactive, they can contribute to inflammation.
So ginger calms them down.
That's the idea. It also seems to reduce other inflammatory pathways implicated in Parkinson's. For multiple sclerosis, or MS, the focus is again on ginger's combination of effects: immunomodulatory, anti-inflammatory, antioxidant.
How might that help in MS?
The hope is that these effects could help reduce demyelination. That's the breakdown of the protective coating around nerve fibers, which is central to MS, and also suppress the overall inflammatory processes driving the disease, again, primarily seen in animal models so far.
That's still pretty remarkable, isn't it? Just thinking about a root potentially doing all that. But you mentioned earlier bioavailability can be an issue, right? Getting these compounds where they need to go, especially into the brain.
Exactly. That's a huge hurdle. Ginger compounds like gingerols and shogales tend to have low bioavailability. They aren't easily absorbed, and the body breaks them down relatively quickly. Their half-lives are short.
So getting them past the blood-brain barrier is tough.
Very tough. And that's where some of the really cutting-edge pharmaceutical research comes in. Scientists are developing new delivery systems.
Like
Things like nanostructured lipid carriers, or NLCs, and polymeric micelles. You can basically think of them as microscopic delivery trucks or capsules designed to predict the ginger compounds and help them get absorbed better and hopefully cross into the brain more effectively.
nanotechnology meeting ancient remedies.
Kind of. And these nano formulations are showing promising results in animal studies for improving brain distribution and effectiveness. It's an exciting area to watch.
Okay, so if listeners are intrigued by all these potential benefits from nausea and pain relief to maybe even brain health down the line, what do they need to know about actually using ginger safely and effectively? What's the practical advice?
Right, the practicalities. Generally speaking, ginger appears quite safe for oral consumption based on the research.
What kind of doses are we talking about?
The studies often use doses ranging from about 0.5 grams up to 3 grams per day. That's often given in capsule form. And these doses were used for periods up to about 3 months and were consistently reported as effective for many of the outcomes we discussed.
Capsules seem common. What about other forms, like those ginger shots?
Yeah, capsules are common in studies for standardization. But other forms work too. Like you mentioned, ginger shots are popular. And, one health article made a good point. You don't have to gulp it down all at once. Sipping it can provide the same benefits, maybe be easier on the stomach too.
That's good to know. Any other forms?
Well, interestingly, for localized pain, like knee osteoarthritis, topical application has also been studied. One trial found a 5% ginger gel applied to the skin was effective for pain relief.
Applying it directly. Okay, now what about safety? Are there side effects or people who should be cautious?
Good question. Safety is key. The FDA lists ginger under the generally recognized as safe, or GRAS category. Doses up to 4 grams per day have generally been reported as safe in studies.
But are there common side effects?
Yes, the most common ones are usually mild and related to the gastrointestinal tract. Things like reflux or heartburn, maybe some abdominal discomfort, or sometimes diarrhea.
Heartburn, right, I've heard that.
Taking ginger supplements with food can sometimes help minimize that heartburn, if it's an issue.
Are there any more serious concerns? Or groups who should avoid it?
Yes, there are some important contraindications. Because ginger can potentially reduce platelet aggregation, basically, slightly thin the blood, it's generally not recommended for people with platelet disorders or those already taking blood-thinning medications, like warfarin.
Okay, that's crucial. Blood thinners.
Very important. Also, if you're particularly susceptible to gastroesophageal reflux, or GERD, ginger might aggravate it because it can relax the lower esophageal sphincter, the muscle that normally keeps stomach acid down.
So maybe not for everyone with reflux issues.
Potentially not.
Yeah.
As always, the best advice is to consult with a doctor or healthcare professional before starting any new supplement, especially ginger, given these considerations. They can advise based on your individual health status and medications.
Absolutely essential advice. Now, thinking about all this research we discussed, even the promising stuff, what are the limitations? Where does the science still need to improve?
That's a really important point to bring up. Despite the large volume of research, there are definitely limitations. A major one is what researchers call high heterogeneity.
Heterogeneity, meaning lots of variation.
Exactly. Across the different studies, there's a lot of variation in the dose of ginger used, how often it was given, how long the study lasted.
Ah, so it's hard to compare apples to apples?
Precisely. There's also often a lack of detailed reporting on the specific type or species of ginger used, or the exact concentration of the active compounds, like gingerols or shogels, in the product being tested.
So you don't always know exactly what was given.
Right. This makes it really challenging to standardize recommendations or be certain that one ginger product will have the same effect as another.
Any other issues?
Well, somewhat ironically, while many of the individual studies included in systematic reviews were actually high quality, many of the reviews themselves, including some within that big umbrella review, were rated as having critically low to low methodological quality.
So the way the reviews were put together wasn't always ideal.
Sometimes, yes. It means we need to be a bit cautious in interpreting some pooled results. Future research really needs to focus on addressing these inconsistencies. We need more studies using standardized, well-characterized ginger products, consistent dosing, and rigorous reporting.
Better standardization, better reporting.
Got it. That's what will really help us pin down the effects more precisely and develop clearer clinical guidelines.
Wow, okay. What an incredible deep dive this has been. It feels like we've gone from, ancient wisdom and kitchen remedies right through to cutting-edge nanotech and clinical trials.
It really spans that whole spectrum, doesn't it?
Yeah. From soothing nausea during pregnancy, easing the aches of arthritis, potentially even helping with blood sugar, weight, and maybe, just maybe, offering some neuroprotection down the road. Ginger clearly has a lot going for it.
It certainly does. It's a powerful example, I think, of how natural compounds can offer really significant health benefits. But, as we discussed, it also really highlights that critical need for ongoing, rigorous scientific investigation. We need those standardized products, those well-designed trials, to truly unlock its full potential and define exactly how and when can be best used in a clinical setting.
Absolutely. So as you, our listener, reflect on all this, maybe consider that link between ancient wisdom and modern science. It often sparks these kinds of inquiries, right?
It really does.
Perhaps the next time you reach for some ginger, whether it's for tea or cooking, or maybe even a supplement, you'll think about the complex science packed into that root, behind its subtle spice, and all the research that's still unfolding.
There's still so much to learn.
Definitely. So maybe think about this. What new area of health research, perhaps sparked by something you heard today, might you want to explore next in your own journey to stay well informed? Something to ponder.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.